Adapting personal care activities in the client's home. This is Unit 5. So bed making adaptations. So you could have a bed that's low to the floor. You could have just the mattress itself that's on the floor. You may need to kneel or squat. There may be it may be up on pedestals because maybe your client is tall. He's like 6'5" or something like that. And you have to get like a pedestal or a stool or something like that to help assist you. Make sure you're using good body mechanics and make sure you are keeping yourself safe as you're making the bed. A draw sheet or pull sheet can be improvised by folding a large sheet in half. If your patient or client is in the bed and they need to be in the bed and you need to move them around, you're not going to have a standard draw sheet because that's just not a standard piece of linen that we have in our homes. So you will make that by taking a standard sheet and folding it in half. You can use a plastic tablecloth or a curtain as a protective barrier if you don't have any bed pads. Make sure that there's some form of a towel or another sheet or a thin blanket or something over the top of that tablecloth or shower curtain so that you don't cause sores and, plastic gets kind of sweaty and you stick to it, so you don't want that. Never shake linens. Always wear gloves. When you are changing out the linen, you do not know what's on there. And, you're supposed to do that in the hospital as well. But even when you're at the home, it's probably even more important that you make sure that you don't shake the linen and you make sure that you are wearing gloves. When you take the linen off, don't touch it up against your body. Put it in the dirty clothes. Put it in the laundry if that's something you're supposed to be doing. Just take it directly in there, but don't have it up against your person. Make sure there's no wrinkles. Same thing, same principles for making beds. Just in the home, you just need to do it maybe not like you do your own, because I don't know if you guys make your beds or not, but do it like your mom and dad would want you to do it. So, if the client's using some sort of a foam crate or an egg crate mattress, they use those to help prevent pressure sores. So if they're at risk, if they're really fragile skin, very thin ladies or men, excuse me, they may have an order for a foam crate. If they pee on it, if it's dirty or whatever, then you do need to discard it, but you need to let the case manager, nurse know, or the family, depending on which. Probably both. You probably need to let both know that you had to throw something away. You typically are going to make a closed bed. Like the picture that's down in the lower left corner. The lower right corner is an unmade bed, obviously, and you cannot have an unmade bed. We do not want our residents that are living at home to just go back to bed. You are there for a reason, to keep them up, keep them active, keep them independent. The more they lay down in bed and just want to sleep or don't want to get up and move around, the more likely they are to decline in their ability to do some of the things they need to do. So make sure you're making the bed, because a made bed is less likely to be gotten back into than an unmade bed. Mobility adaptations. Use a gait belt even in the home. When you're assisting with turning or sitting up, you can have a rope that's tied to the foot of the board or foot of the bed, or you can, they do have some at Walgreens. They have little side rails. They're little half-moon shaped type rails that you can secure underneath the bed, and then they can use that to manipulate themselves in and out of the bed. There is something called a slide board, which these pictures right here show the slide board. So you can see this guy is going from his wheelchair across the slide board into the tub onto the shower chair there. So that's kind of how it works. They can do it into bed as well. They can go from chair to chair. So that may be something that is, this is a chair slide board. There are bed slide boards that you should be aware of, but typically your patients are going to be able to do this with just you as a standby assist, because they're used to doing it, unless they're brand new at the home, and then you'll have to kind of teach them how to do it. If you're assisting a client to and from the wheelchair, from car, into a car, you need to give yourself as much room. Push the chair back as far as you possibly can. Get the wheelchair as close as you can. Allow them to use the door of the car to hold on to. If you need to lower the window so that they have some sort of something to hold on to, then do that. Physical therapy will instruct on the use of the cane or walker. But if you feel like, I don't know that they're walking quite right, or the cane looks a little bit too short or too tall, like they're not comfortable in their positioning when they're walking, you need to let the case manager nurse know so that she can contact therapy and maybe have them come out for an evaluation. Your whole goal as a home health assistant or home health aide is to identify problems early so that the patient doesn't decline to the point that they need to go back to the hospital. If you can identify the problem that looks like maybe they're not doing as well here, like with walking, or they're not able to do as much in the shower as they used to, and you can pick up on those small, subtle changes that are happening where they're declining, and we can get therapy back into the home to build them up, to strengthen them some, then we'll keep them out of the hospital a lot more frequently, and that's good because patients that go to the hospital tend to decline pretty rapidly, and you never get back the full functionality that you had before the hospitalization. So the goal is definitely keep them out of the hospital if we can. This is just a demonstration of how to transfer with a gait belt. Make sure you're using proper body mechanics. Long periods of immobility cause muscle atrophy. That's where the muscle begins to disintegrate and to die and becomes very thin. If you've ever seen somebody who has lost the use of their legs and how small their legs look in comparison to what they used to look like when they were up moving around, that's what happens. So as a home health aide, you have the ability to, even though your patient is immobile and in bed and you're doing everything for them, do some range of motion on them. Do passive range of motion. Have them do some active range of motion, whatever they can do, so that they can get the exercise that they need to help keep their muscles from atrophying and not being useful at all. You need to make sure that you're protecting your resident from getting pressure sores. Pressure sores are completely preventable. If they get a pressure sore, it's because they were neglected long enough that the blood supply got, decreased to that area and the skin broke down and broke open, and now we have, muscle tissue, whatever. I had one patient in my home health experience that had a pressure ulcer. He was a large man, probably 400 pounds, 500 pounds possibly, and he had to have what's called a flap surgery, where they go and they cover, they take a skin graft from a leg or something, and they covered over, made a new skin area on his coccyx, on his tailbone, because he had sat and he was so large he didn't realize it. He was diabetic, so he didn't feel it that he was getting a sore, and that sore ended up being like that big around and about that deep down into his skin. He said that a Pepsi can, you could stick that down into that bed sore. So do not be very vigilant by looking at your patient's skin, especially when they are immobile, because you don't want that to happen, because that comes back on you. These are positioning devices. You do need to know the difference between a trochanter roll. Foot cradle, obviously, is something that keeps the foot from going the foot cradle is something that keeps the bedding and stuff from touching the client's feet and legs. And that's important because sometimes just the bedding is enough pressure on the toes that can cause a sore, or causes enough pressure to come down and make the heel get a sore. So look over everything. So know these positioning devices. In the tub or shower, typically you're going to have an order as a home health aide for 2 to 3 times a week that you're going to do a shower. Make sure that everything's safe. They've got a rubber mat. They're not going to slip. If they're unable to stand, put a chair in there. If it's not big enough for a chair, talk to the nurse case manager. Figure out what you guys can do. Do not leave your clients unattended, especially if they are unsteady or confused, because if they fall, it comes back on you because you were the one in the home and you're the one that put them in that room and in that situation. And that is negligence when you do something that ends up in where you take a patient and you put them in a unsafe situation and then you leave them. That is a negligent situation, so you can lose your license for that. Bathing techniques, make sure that if they require a transfer belt, use a transfer belt to get them in and out of the tub if you have to step over the tub wall. Never apply the belt onto bare skin, so you get them in, dressed, then you undress them, and then you let the water run completely out. You dry them, you get them dressed in the tub, and then you get them out of the tub if they require the use of the gate belt. Not everybody will, but some will. Showers, sometimes some of the showers now actually come with a seat already in there, but you've got to be careful because sometimes those seats and the floor, even though it's got kind of a grainy aspect to it, it's still pretty slick. So you still have to be careful. Maybe throw a towel down, give them a little bit more traction. Lotion can be used after bathing, but don't do it while they're in the bathtub because getting them out of the bathtub, it'll make them slippery and then they may fall, and that's going to be an issue for you and for them. Oral care, encourage them to do it twice a day, morning and night. Assist them where they need assistance. Encourage them to do what they can do when they can do it. Don't just do it because it's easier. Shaving, same thing. If they can do it on their own, let them. Maybe you need to be a standby assist. Maybe you just need to hand them the razor and say, here you go. Typically, we don't want the straight edge razors. We want the electric razors because we don't want to have the bleeding. If you do have a straight edge razor and they cut themselves, hold pressure on it. If it becomes, and you do need to let the nurse know, hey, they cut themselves while shaving. I held pressure. It's stopped bleeding, but just so you know, they do have this because we have to, as nurses, keep track of everything that's on that patient's skin, any bruises, any bumps, any cuts, anything. So make sure you let them know so that we know where it came from. Washing the person's hair in bed, you can use a shampoo pan. You can use like a wash pan, like a dishwasher, not a dishwasher, but like a stove. An oven pan for water. You can use cups. Protect the sheets with the plastic coverings that we've already discussed, and just do it. Be as clean as possible, and don't make more work for yourself by putting by making the bed completely wet. And now you have to change the bed. Measuring I&O, not everybody's going to need this, but you will have care planned for some people that will need it. So make a list. What type of cups do they have in their home? What sizes? Bring some sort of a graduated container and actually measure out how much is this, so that you know how to do that. Always use standard precautions. These are just your graduated cylinders, your measuring devices. Allow the resident to feed themselves as much as possible. We have, as you can see on the screen, that's a adaptive spoon. So you can take, if it's a toothbrush, if their hands are too arthritic or something, you can take a washcloth and wrap it and tape it so that it's bigger around so that they don't have to have such a small hold on it. Do whatever you possibly can to make those things adaptable so they can do them on their own. And talk to the nurse, talk to the therapist, figure out what they need. Dressing adaptations, the occupational therapist will come in and recommend certain devices, so make sure you understand that it's OT that's in charge of that, and you just need to follow their direction. There may be special communication things you need, writing on a board, adaptive things. So read through those, kind of take a look at the different things. If you need to obtain equipment, contact your nurse. and have her talk with whoever needs to. But that's going to be your biggest advocate right there. So, all right, that's it. Have a good day.